In January, CMS notified the state of Minnesota that it was acting to withhold about $2 billion in funding for 14 Medicaid services over the next year.
At a House Energy Committee hearing this week, Representative Yvette Clarke took direct aim at the Trump administration over its handling of Medicaid funding, calling out what she sees as a dangerous pattern of cuts and delays that could undermine the nation's healthcare safety net. Clarke didn't mince words. She argued that pausing or reducing Medicaid funding isn't just a fiscal decision, it's a policy choice with immediate human consequences. Medicaid, after all, isn't a marginal program. It covers tens of millions of Americans, including children, seniors in nursing homes, and working families who rely on it as their primary source of healthcare. Make sure you listen till the end, otherwise, you might miss it when it cuts off.
With that, I now recognize our ranking member of the subcommittee, Ms. Clarke, for her opening statement.
Thank you, Mr. Chairman, and good afternoon, everyone. At last month's hearing in this subcommittee, Democrats expressed our deep concerns with the reckless way the administration was using claims of fraud in health care programs to justify its violent immigration operation in Minneapolis, where 2 Americans exercising their First Amendment rights were killed by DHS officers. President Trump has weaponized the entire government to punish states and political leaders he does not like. And agency leaders are complying with his retaliatory agenda. Unfortunately, it includes the Centers for Medicare and Medicaid Services. In January, CMS notified the state of Minnesota that it was acting to withhold about $2 billion in funding for 14 Medicaid services over the next year. This threatened funding cut will affect home and community-based care for older Americans and the disabled, services for people with substance abuse use disorders, and services for children with autism. Minnesota health officials are pushing back on this threat, saying these cuts would be, quote, disastrous, end quote, for Medicaid beneficiaries in the state. One day after President Trump declared a war on fraud at the State of the Union, Vice President Vance and CMS Administrator Oz held a press conference to announce additional Medicaid funds would be held from Minnesota, which could result in as much as $1 billion in additional cuts. Taking billions of dollars from the state of Minnesota and treating the state like an enemy rather than a partner will not make its Medicaid program any less vulnerable to fraud. What it will do is hurt hundreds of thousands of Minnesota residents who rely on Medicaid services to live independent and healthy lives. And CMS is expanding its so-called investigations to more states, California, Maine, and my home state of New York. It is painfully obvious why these states and Minnesota have been targeted. They are all states led by Democratic governors that President Trump lost in the 2024 presidential election. And in the case of Minnesota, the governor was the Democratic nominee for vice president. He pointed out that the president and the people around him are weird. And now the president is taking away health care from his state's residents. These are the petty reasons why the entire Trump administration is going after certain states and why we can expect they will continue to follow the same playbook elsewhere around the country. And just minutes before the hearing started, the CMS inquiry has expanded to Florida. Politically motivated enforcement has real consequences for our constituents. Medicaid is a lifeline for more than 70 million people in this country. Patients pay the price when billions of dollars are withheld for entire categories of services rather than specific claims. CMS and congressional Republicans want us to believe that the cuts only hurt fraudsters, but in reality, they are intentionally tearing down the Medicaid program. These cuts to Medicaid funding are just the latest Republican efforts to reduce health care services. I don't want to see that happen in New York, Minnesota, and elsewhere in the country. Democrats want to improve access and affordability of health care for everyone and strengthen the federal health care system so it is efficient and sustainable. The abuse of taxpayer dollars is coming from the President of the United States, who is using government resources as his personal revenge fund to punish his political enemies. Congress should not sit by while CMS abuses congressionally appropriated funding to take vital services away from people. We don't need to choose between consistent funding for Medicaid and combating fraud. We can and must do both if we repair the damage being done by this administration and the congressional majority. To start, we need to restore the nearly $1 trillion Republicans cut from Medicaid in their reconciliation bill last summer. Today, we want answers from the CMS Deputy Administrator about the attack on healthcare in Minnesota, any similar plans for other states, and the impact of these attacks on the health of Medicaid beneficiaries. Deputy Administrator Brandt, I hope that this is an opportunity for all of us to finally get some real transparency and specifics from an expert at CMS, rather than the rudderless partisan attacks that we have seen from Dr. Oz.
Her concern centers on instability. When funding becomes unpredictable, states are left scrambling. Budgets must be reworked, services reevaluated, and in some cases, scaled back. Clarke stressed that this kind of uncertainty makes it nearly impossible for states to plan effectively, and ultimately puts patient care at risk. The criticism also ties into a broader challenge to the healthcare philosophy of Donald Trump and his administration. Clarke suggested that these funding decisions reflect a long-standing effort to shrink federal responsibility in healthcare, an approach that, in her view, disproportionately harms lower-income communities. On the other side of the aisle, defenders of the policy argue that reform is necessary. They point to rising federal healthcare costs and insist that states should have greater control over how Medicaid dollars are spent. In their view, flexibility can drive efficiency and innovation. But Clarke's argument is clear: flexibility without funding doesn't solve problems, it creates them. She warned that shifting responsibility without adequate financial backing could widen healthcare gaps, particularly in already underserved areas. What makes this issue especially urgent is the broader economic backdrop. With many families still facing financial pressure, access to affordable healthcare remains a critical concern. Any disruption to Medicaid, Clarke argued, risks pushing more people into difficult choices between paying for medical care or meeting other basic needs. In the end, this exchange underscores a deeper divide in Washington. It's not just about numbers on a budget sheet, it's about competing visions of responsibility, equity, and the role of government in ensuring healthcare access. Thanks for watching. Don't forget to subscribe to the channel and turn on notifications so you never miss an update.